And welcome back to WGN-TV Political Report. As the state expands vaccine eligibility to all Illinois adults tomorrow, it may look like there is some light at the end of the tunnel. But for many families across the state, the economic fallout of this pandemic will be felt for months, probably years to come. This week, State Senator Mike Simmons of Chicago's North Side put forward a plan he says will help working families, especially families of color, recover and complement a similar credit in the American Rescue Plan. If approved by the legislature, the proposal would create a per-child tax credit at the state level. Individual parents making $40,000 or less, couples making $60,000 or less would get a $600 tax credit. Now, that amount decreases slightly for each few $1,000s added on to the income level. The credit is cut off for individuals making $64,000 or above and couples making $84,000 or above. The plan would cost the state around $750 million and would be available in time for next year's tax filing season. This is Senator Mike Simmons' first bill after being sworn into the legislature back in February, and he joins us this morning to talk more about his plan. Senator, good to see you. Welcome to the show.
Good to see you as well. It's good to be here.
So in this plan, which I've just described, my question will be this. How much impact do you expect that it will have? And I say that because unlike what the American Rescue Plan is giving, you're not sending checks for $600 to people. It's going to be a credit they get, which means it's money that they're going to kind of get down the line in a tax saving. So how much impact do you expect it to have?
Well, initially, this is going to have a lot of impact for individual families. So a lot of constituents in the 7th District are working parents. One of the 3 households is headed by a single parent. And we all know that our working families have been hit the hardest by this pandemic. 1 out of 3 hospitality workers has been laid off. Essential workers have been on the front lines of this public health disaster since day one. And so this is really an opportunity to bring them some economic relief that is long overdue from long before the pandemic and especially now. And then the second part of this that's beneficial is that the savings that those families have will go right back into the local economy because people that aren't making a lot of money don't have the luxury to save it. And so they've got to go spend that money on goods and services, food, paying back rent, paying for medical bills, in some instances going to the doctor because they often are putting that off because they can't afford it. And that's going to have a multiplicative beneficial impact on the local economy.
So you've kind of hinted at this in your last answer, but let me just take it one step further because you don't see this as a temporary move. This is a permanent change you want made to the tax code in the state. So I guess the question is this idea of yours really much more about the pandemic, something you might have introduced anyway, even absent the pandemic? And the reason I ask that is because it will certainly be welcomed in the time of a pandemic, but we're in a state that doesn't know where its next dollar is coming from. So does it create financial problems for the state down the line, and then they're going to have to find some other way to make up that money through a tax or some kind of fee?
Well, I think all over the state from Chicago on down to Southern Illinois and on out to the Quad Cities, all of our constituents are dealing with just the economic devastation that's been brought on by the pandemic. And a lot of that pain was felt before the pandemic. And what we've learned from the pandemic is that a lot of these issues are structural, that people are often stuck in low-wage jobs or working 2 or 3 different transient jobs trying to piece together an income to take care of their families. And so my thinking is that if you give those families a little bit of economic relief, that is going to have an immediate benefit on the economy, right? 2/3 of the economy is comprised of consumer spending. And so we know that folks at the bottom of the economic ladder are consumers. They have to be. They don't have the luxury to save. And so that is going to benefit the local economy and the regional economy if we're enacting that permanent child tax credit at the state level. That's going to lift the economy up over time.
So
for our revenue.
And related to that, hopefully, we're already seeing jobs are coming back, right? That's great to see. Hopefully the restaurant industry and others are going to continue as things open up. Let's hope things don't turn backwards and they open up. So I guess my question is, welcomed relief right now, but in a year or 2 or 3, as things are, let's say, hopefully return to normal, maybe even better, is this something that we'll look at and say, maybe it didn't need to be a permanent part of the tax code. We just needed it to get us on our feet?
No, I think that this type of relief is needed on a permanent basis. I mean, again, the issues here predated the pandemic, right? 5-10 years ago, a lot of our single parents and working families were struggling in the same way. The pandemic has just brought a bigger level of trauma, a more immediate and blatant and obvious type of economic trauma to those at the bottom of the economic ladder. And so I would argue that we want those families to have permanent relief. Certainly during a pandemic, right? That to me is a very straightforward proposition. But over the next 5 or 10 years, we want those families to be living a dignified life. We want them to be able to take care of their children. We want them to be able to afford childcare. We want them to be able to afford to eat, right? Just being able to put food on the table. We want them to be able to live in apartments that have lights, that have heat in the winter, where there's warm water and all these other things. And that's the type of need that's going to last long beyond the pandemic.
And let me just touch base on your district and vaccine distribution. How is it going? Are you getting enough supply? Are you seeing equity in the administration of vaccines in your district?
This has not really worked in the most equitable way across the country. And so I think that the political will is there to try to do this in a more equitable way. But what I can tell you in the 7th District is that I requested a briefing from the Illinois Department of Public Health about a week ago. And when I looked at the zip code level data, the most inequitable infection rates and access to the vaccines were showing up in 60626 and 60659, which is Rogers Park and Westridge. Those are communities where you have just a lot of immigrants, asylees, refugees from other parts of the world, and just a whole host of folks who are low income, who, structurally don't have easy access to healthcare at all. And so what I've tried to do is to go out of the way to partner up with my community organizations, such as Howard Brown, the Ethiopian Community Association, One Northside, and others who can bring the vaccine to the community. And my thinking there is that you have to do that because these folks don't have easy access to healthcare, so they're not likely to get the vaccine today, tomorrow, or next year. So we've got to bring the vaccine to them. We have to meet them where they are. And we have to overcome the trust barrier that they have because historically they have not been well served by the healthcare system.
Less than a minute to go, but it's your first time on the show, so I want to ask you. You're the first openly gay member of the Illinois Senate, first senator of color from your district, representing your district. I know you've worked for Durbin and even Senator Obama and Rahm Emanuel, but I have a feeling more than any of that, you are driven by the message from your mother who told you to make a difference in society. Is that a fair enough comment to make?
It is. My mother was the most loving person and just did so much so that my sister and I could achieve our dreams, run for office, start our own business, and be healthy, viable adults. And so she's a very compassionate woman. Unfortunately, she's no longer with us, but her spirit drives everything I do. She was a very compassionate person. She asked me to make a difference for other people. And so that is how I'm trying to show up in my public service.
And she'd be proud to hear what you're doing here on our show this morning. Thank you for your time. Have a great Sunday, and we'll see you again soon.
Thank you so much.